Welcome back. Now, the Department of Health in the Western Cape needs to shut down certain parts of Tygerberg Hospital in order to clean and sanitize this, according to unions FEDUSA and HOSPERSA. The union also claims that the hospital, which is the largest in the Western Cape, is a ticking time bomb and has become a breeding ground for the coronavirus. They also say that healthcare workers are up in arms as they have no access to personal protective equipment, and that both visitors and patients walk around and enter the hospital without being checked, and that there's also no sanitizer or social distancing being enforced. And this comes after a fourth nurse from Tygerberg Hospital succumbed to COVID-19. And Morning Live extended an invitation to the Department of Health in the Western Cape in order for them to join this discussion, but so far we've had no response. But joining us now is Martinique Marinus from HOSPERSA to talk to us about their allegations. Thanks so much for your time and welcome.
Good morning to yourself and good morning to the viewers, and thanks for having me here.
Now,
Yes,
Martinique, just before you lay it out, you said that HOSPERSA and FEDUSA went to the Tygerberg Hospital recently, and what you witnessed were large-scale atrocities. Can you just tell us a little bit more about that?
Upon our arrival at Tygerberg Hospital, we've noticed even when we access the gate, the main gate, we weren't asked by no security where we are going. As we entered the main hospital, there was no one asking or screening us or taking even our temperature for that matter. So we just entered the facility. We had to ask, is there any hand sanitizer available, etc. And we were just being simply ignored by the department officials there. As we were walking on the premises, we've noticed that there's absolutely no social distancing taking place. For us, it's a big concern. These are regulations. Tygerberg Hospital is the epicenter of the Western Cape, yet that very same hospital is not complying with regulations. And for us, that's a big concern.
Now, I also see, which I thought was hugely disturbing, you spoke about another observation of the body of someone who had died of COVID-19 that was being pushed around as you entered that facility. Can you just give us a little more clarity on that?
Yes, this happened while we were sitting in the emergency unit of Tygerberg Hospital together with other patients. We saw the porter coming past with a body and we asked, what is the cause of death? And his response was simply to us, it's another COVID-19 death. And I mean, we are sitting there, we're part of the public, and it pushed this body just into a lift, which is also accessible to us as the public. So for us, that's really a big concern because these lifts are being used by the hospital. They are escorting COVID-19 patients in it as well as corpses. And from there, we have observed whether these lifts are being sanitized after, a while. And to our surprise, nothing was done. So for us, is that maybe one of the reasons that our figures are increasing because the epicenter themselves is not adhering to occupational health and safety standards?
Well, Martinique, you did meet with the Western Cape Department of Health, I understand, to discuss the current situation at Tygerberg Hospital. What came out of that meeting?
The department, the stance is still, we will not close the hospital. I did make it known to them that I'm still waiting on a response from the CEO because we are willing to negotiate to see how can we take this matter forward. We've also requested what is the operational plan in terms of staffing, knowing that they have such a high increase of affected staff members there. So also, it was told there is no operational plan. Now, we ask ourselves, the Western Cape Department of Health is saying we're not at the peak yet. So what's going to happen when we really do hit the peak? So for us, that's really now a very big concern, and management needs to come to the table to discuss how we can do this together and for us, we are saying, we are willing to meet our members' safety comes first. But if management is simply ignoring our request, how can we fight this COVID challenge together?
Now, indeed, how do you do that? Because one of the other issues that you flagged, Martinique, is you say that healthcare workers don't have access to personal protective equipment, and they are up in arms saying that their lives are important too. And we know that 4 nurses have succumbed already at this institution to COVID-19 related incidents. So can you just talk to us about what the nurses are actually going through, and can we expect strike action if the situation doesn't improve?
In terms of PPE, there is the issue about the accessibility to this PPE. We're not disputing that they don't have. They have PPE, but it's the issue of accessibility there. Nurses need to wait and get permission, and PPE is being locked away. Members have raised concern. What they are coughing in their mask, so they need to remove it immediately, and it must be replaced. But now patients, they need to wait because we have instructed our members, if you don't have your PPE, you will not perform your duty. So, which is also what we are saying is it's causing a delay in the service. On the other hand, because why should PPE be locked away and not accessible to the staff? So that's really a big concern.
So FEDUSA also saying that an investigation should be launched to look into the deaths of certain patients who allegedly died of COVID-19. Can you perhaps just explain to us, as an affiliate there, what exactly this is about and why you are putting forward this request?
It's simply because what we've discovered, the communities is where people are saying, look, my mother and father did not pass away with COVID-19. He or she passed away, with a heart, or natural causes. Why is it being listed as a COVID-19 death? So that is quite a concern. Is this now about the numbers? What's happening? So members are, even the community members, they themselves are confused. For them, is why should every death nowadays be listed as a COVID-19 death, which is so unfair?
So I don't quite understand that. What does that mean? Because if you say family members are saying the person died of something other than COVID-19, why then would it be listed as COVID-19? Has anybody sought an explanation from the healthcare professionals themselves at that point?
No, we are still waiting on confirmation from, in fact, pathologists to tell us why is the cause of death listed as a COVID-19. So we have not received any response to date, but we will follow up as to why are they doing what they are doing.
Are you suggesting, Martinique, that the figures, the numbers that we are seeing for the death toll relating to COVID-19 in the Western Cape may be inflated?
Well, from what we've heard from the community, it seems like, that not all those deaths are COVID-19 related, So for us, it's why, why are the figures just being increasing and increasing? Is this now about numbers, So for us, it's really a concern.
And just a final question with regard to another of your requests, which is the partial close down of parts of Tygerberg Hospital. How do you suggest this should be done? Because this is, of course, the biggest hospital, and as you say, the province and the Cape Metro in particular already feeling the strain of dealing with COVID-19 related illnesses. So how do you suggest they go about this?
From us, the request is if they can start closing down certain wards and start decontaminating. Practically, yes, it is possible, but we have another challenge because we are saying all new referrals must be referred to your field hospitals. The Department of Health yesterday confirmed that these field hospitals are not ready yet. So we are asking ourselves, we've seen all over the media, the Western Cape, we are ready. We've got the field hospitals ready. For us, it's a concern when they confirmed yesterday, these hospitals, in fact, are not ready yet. So, because that was the suggestion made from us to say, start moving and don't move out the current patients, work on them because the patients will be discharged and God forbid that some of them will maybe pass away to free up the space. So the moment space becomes available, decontaminate and start all over. Start getting your OHS, your IPC and control, your risk assessments. And, that was just a simple request, but for us, it's shocking to hear that these field hospitals are not ready yet.
Just a final question, Martinique. The President is headed to the Western Cape. What would you like the President to pay attention to during his visit?
The issue of testing and the issue of backlog of testing. For me, it's quite a concern when you see this backlog of tests and the capacity that the lab can in fact take per day. Now, my question again comes to, if you know that the lab can only take a certain amount of tests a day, why would you go about testing 5 times more than the actual capacity? Because we've done our research and it was said and also confirmed by the Department of Health that your specimen becomes defective after 5 days, which for us now, it's really a big concern if you look at it. If the lab can only test 2,000 per day, for example, and there's a backlog of 27,000 tests, which means it will take them 14 days to actually test, run through all the specimens, yet the specimen becomes defective after 5 days. So when you, in fact, maybe you could have been positive and your result would come back maybe negative, it is quite a concern. So if the President can really attend to that issue, we will appreciate it. Thank you.
Martinique, some very interesting issues that you raise, and hopefully we can continue this conversation next week and maybe come back along with the Western Cape Department of Health to answer some of these questions. But thanks so much for your time, Martinique Marinus from Union HOSPERSA, talking to us about the allegations that Tygerberg Hospital in Cape Town is a breeding ground for COVID-19. And as mentioned, we did ask the Western Cape Department of Health to join this discussion. We haven't heard back from them yet, but the invitation still stands. Please talk to us, even if it is next week. Right, let's take another quick break before we read a few more of your messages.